to provide more specifics concerning specific shipment dates and quantities in next week. Avec des millions de doses supplémentaires,
with millions of additional doses coming before the end of June and during the summer months, and that is only based on the confirmed deliveries, Canada is about to receive at least 55 million doses by the end of July. To be clear, that is the minimum number of doses that we anticipate receiving in that timeframe. I work every day with an incredible team at a PSPC, and we are continuing to put pressure on suppliers to accelerate dose deliveries. And we've been doing that since day one.
Millions more doses arriving prior to the end of June and into the summer months. Based on confirmed deliveries alone, Canada is set to receive at least 55 million doses by the end of July. To be clear, that is the minimum number of doses that we anticipate receiving in that time frame. Given my work every day with an incredible team at PSPC, we are continuing to press suppliers to accelerate doses as we have from day one. In fact, we have accelerated 28 million doses from later to earlier quarters in this year alone. In closing, these past 2 weeks have been extremely difficult for our country, for Indigenous communities, and for our Muslim brothers and sisters. While my focus is on bringing vaccines into this country, my heart grieves with you. Rest assured that our government stands with you also. Shukran, thank you. Megwach, merci beaucoup.
Thanks very much, Anita. We'll now turn to the Health Minister, Patty Hajdu.
Thank you very much, Dominic, and it's a pleasure to be speaking to everybody today from the traditional territory of the Robinson Superior Treaty Area, and of course inhabited by the Fort William First Nation, who are the carekeepers of this land now, along with all of us. So listen, Canadians have been doing astronomical work to protect each other over the last year and a half. They've followed public health advice. They've stayed home. They've made changes to the ways of their life to keep everyone safe. And we know that Canadians have sacrificed so much to protect each other. And the government of Canada also has some of the strongest border measures in place to help protect Canadians. We've used data, we've used scientific evidence, and we've monitored a situation both in Canada and internationally to adjust our measures as the situation warranted. And we've been clear with Canadians that we would continue to adjust measures as appropriate as the situation evolved. And we're now seeing a ramp up of vaccination rollout across the country. Nearly 70% of Canadians have received their first vaccine dose to date, and second doses are rising rapidly. And we know that these vaccination rates matter. Vaccines are saving lives and stopping the spread. But we also know that the strong public health measures that are in place across the country are contributing to lower case counts and reduced hospitalization. And these metrics are the metrics that we'll continue to monitor that will inform the changes to the measures in place. Now, with the situation improving in Canada, today I want to provide Canadians with more details on what they can expect in the coming weeks. As the Prime Minister has said, we'll take a phased approach towards adjusting current border measures, with the health and safety of Canadians being our first priority. What is currently being considered as the first step in this approach is to allow fully vaccinated individuals currently permitted to enter Canada to do so without the requirement to stay in government authorized accommodations. Travelers would have to be fully vaccinated 14 days or more prior to their arrival. And they will still be required to have a negative pre-departure PCR test result and required to be tested. And we'll be watching carefully here in Canada and around the world as cases change and as vaccination rates rise. These metrics are very important factors as we move towards implementing the changes on the border that we hope to have in place in early July. Now, all of these changes are only possible if we continue to protect each other. And we know how to do that after a year and a half. Get vaccinated when it's your turn. Follow up for your second dose. Make sure we're following the public health measures that we've all learned over the last number of months to protect each other. If we can keep our communities safe and free of COVID, then we will not have to return to measures that are so difficult for everyone from a social and economic perspective. And this is only possible because of the tremendous efforts of Canadians. We know Canadians have sacrificed so much, so I want to thank Canadians, all of those who have stepped up to get their first and second dose of COVID-19 vaccine, to help others get vaccinated. We really can see the finish line. So let's continue together. Merci.
Merci, merci beaucoup, Patty. Alors, pour faire...
Thank you very much, Patty. So to summarize what Patty just announced, throughout the pandemic, Canadians have made extraordinary sacrifices. They followed the public health measures, they stayed home, and they adjusted their routines to protect other Canadians. For its part, the Government of Canada set up strict measures on the border. Those border measures to protect Canadians were designed based on data and based on the advice of experts and doctors and, of course, the situation in the world. We were clear with Canadians. We said that the measures would be adjusted as appropriate based on the changes and development of the health situation. And we can see now that the vaccination campaign is going well. Over 70% of Canadians have received at least one dose of the vaccine. Vaccination is key. So are the public health measures, and so is the drop in case rate and in the number of hospitalizations. These are indicators that we look at to decide which changes need to be made. With the improvement in the situation in Canada, I would like to give Canadians more of an idea about what they can expect in the weeks to come. As Prime Minister Trudeau has said a number of times, we will adjust border measures gradually, keeping the health of Canadians first and foremost in our sights. The first phase that we are considering now is aimed at allowing fully vaccinated individuals who are authorized to enter the country, so Canadians, permanent residents, and essential workers, to be able to cross the border without having to stay in a government-authorized accommodation. Fully vaccinated individuals are those who have received the required number of doses of an authorized vaccine against COVID-19 authorized by Health Canada. Fully vaccinated individuals will still need a screening test before departure, as well as a COVID test upon arrival. They will have to be in quarantine at home until they get a negative result to their day one test upon arrival. As we have said before, the vaccination campaign and the public health measures are what we are following as we move toward a changing situation. We are obviously consulting with provinces and territories as we do this, and we are expecting this to happen at the beginning of July. We will continue to monitor the situation, and these changes will only be made if the case count continues to drop and if the vaccination campaign continues to go well. Any other changes in the context of the next phase will be based on data at home and the situation worldwide, and once again will be done in consultation with the provinces and territories. We will continue to inform Canadians about what is going on. The cautious changes that we can now think of making are only possible thanks to the efforts of Canadians. So I really want to say a huge thank you to you for the sacrifices you have made, and I would like to encourage you to get vaccinated for your first or your second dose. Thank you. And now I will turn the floor over to Dr. Tam and then Dr. New.
Merci and bonjour à toutes et à tous.
Thank you, and hello, everyone.
Indicators of COVID-19 disease activity and severity continue to decline. This week, 7-day averages for case numbers have fallen below 1,800 cases reported daily for the first time since the fall of 2020. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has dropped more than 55% since the peak to under 2,000 daily. Of these, on average, less than 8,050 were being treated in intensive care units, which is 40% fewer than the peak number. And the average daily deaths are also down almost 40% to 32 deaths being reported daily. I know we are all eager to do more things we miss, and as provinces and territories accelerate second dose programs over the coming weeks, we are moving ever more quickly towards this. As always, things are not the same for everyone everywhere, so deciding when and what layers of protection to peel back depends on several variables, such as our personal and family health and vaccination status, COVID-19 activity levels in your community, and what settings and activities we are engaging in. Though each of us have different health, work, and family circumstances that affect our risk comfort level, expanding one-dose programs has provided many more people with priming immune protection to reduce the risk of serious harms from COVID-19 infection. But one dose of protection is not enough. Based on estimates before the Delta variant was circulating, an estimated 1/3 of people can still get infected after just the priming dose, and an estimated 20% can develop serious illness. These estimates may be different with the Delta variant or other future variants. This is why public health measures and individual precautions continue to be important while COVID-19 is still circulating widely and second dose programs are ramping up. Getting fully vaccinated with a second immune boosting dose substantially lowers our personal risk of infection and serious harms, provides stronger protection against certain variants of concern, including the Delta variant, and may make immunity last longer. While we can all breathe a little easier, knowing that most of us have received our first dose, with COVID-19 still circulating, we're all advised to continue following public health advice and keep up individual precautions until more of us are fully vaccinated and COVID-19 infection rates are low. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Hello, everyone. Nationally, all indicators of COVID-19 activity and severity continue to decline. This week, 7-day averages for case counts have fallen below 1,800 cases a day for the first time since the fall of 2020. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has dropped more than 55% since the peak, and it has dropped to under 2,000 daily. Of these, on average, less than 850 were being treated in intensive care units, which represents a 40% drop from the peak number. And average daily deaths are also down by almost 40% to 32 deaths being reported daily. I know that we are all anxious to do more of the things that we miss doing. And as provinces and territories accelerate second dose programs over the coming weeks, well, we are moving ever more quickly toward that goal. As always, things are not the same for everyone everywhere. Deciding when and what layers of protection to peel back depends on several variables, such as our personal and family health and vaccination status, COVID-19 activity levels in the community and what settings we are in and the activities we participate in. Home, work, and community factors are not the same for all. But once one dose of protection has been provided, well, then the safety is higher for people, and people are less likely to be severely ill. But one dose of protection is not enough. Based on estimates from before the Delta variant was circulating, an estimated 1/3 of people can still get infected after just the priming dose, and an estimated 20% can develop serious illness. These estimates may be different with the Delta variant or other future variants. This is why public health measures and individual precautions continue to be important while COVID-19 is still circulating widely and while the second dose programs are ramping up. Getting fully vaccinated with a second immune-boosting dose substantially lowers our personal risk of infection and serious harms. It provides stronger protection against certain variants of concern, including the Delta variant, and may make immunity last longer. We can all breathe a little easier knowing that more of us have received our first dose. With COVID-19 still circulating, though, we are all advised to continue following public health advice and to keep up individual precautions until more of us are fully vaccinated and COVID-19 infection rates are low. Thank you.
Thanks, Dr. New. And obviously now we're all happy to take your questions. Merci beaucoup.
Merci. We will now take questions for about 25 minutes. We'll conclude no later than 1 p.m. As usual, it will be one question, one follow-up. Alors maintenant, je vais passer à l'opérateur pour prendre la première question, s'il vous plaît.
Thank you. Merci. Please press star 1 at this time for any question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And the first question, la première question est de David Turton from CBC News. Please go ahead, la parole est à vous.
Hi, good morning, everyone. This question is for Minister LeBlanc. In 2019, Canada signed on to the Christchurch Declaration to eliminate terrorist and violent extremist content online. And the Prime Minister promised a new charter to combat hate speech. But from our understanding, that hasn't happened yet. Why hasn't more been done, Minister, to address online hate?
Well, thank you. Thank you for the question. And obviously, like all Canadians, the events of this week were deeply shocking and tragic. Our government has committed, and my colleague, the Minister of Canadian Heritage, has in his mandate letter the obligation to work with me and across the Government of Canada directly on combating online hate. This is obviously one of the elements that fuels the horrendous acts of violence that we've seen not only in Canada but in other parts of the world. So I know the Minister of Canadian Heritage will, in the coming weeks, have much more to say on this specific element, as will the Minister of Justice. And our government is continuing to be very committed to doing what is necessary, obviously working with the social media platforms to combat online hate, and we'll have more to say on specific measures in the coming weeks.
David, follow-up?
Yeah, I'm going to switch gears here and go to Dr. Tam with this question. In recent weeks, Dr. Tam, you've suggested that if 20% of Canadians are fully vaccinated and 75% partially, then that would be considered an acceptable level or benchmark for things to somewhat be normalized. So the question is, could that benchmark change, especially knowing that the Delta variant is in our country?
Thank you for that question. Of course, having the full course of vaccine is extremely important, so everyone needs to do that. And we are going to see the provinces and territories reducing the interval. Minister Nan has announced even more vaccines, or clarifying the Moderna vaccine coming in, for example, in June. So I expect that second dose to be provided faster as the weeks go on. So I do think that it's really important to have that second dose. But if you take into account various indicators at the same time, not just the vaccine targets, but 75% first dose, 20% second dose, based on our modeling data, I think that is still going to be protective against hospitals from being overwhelmed. That was what our model looked at. So I think that estimate still holds, and that if the conditions are going in all the right directions, some provinces are easing their measures. If you have the Delta variant in your particular community, you have to be really careful what you do in between the first and second dose, for sure. We can't be too careful about that, and getting to 75% as quickly as possible is a reasonable target. Of course, I've also said shoot for the stars, go higher. As much as we can, given that we need to protect each other. There are people in the community that can't get the vaccine, for example. But I think, as Minister Hajdu has pointed out, our border measures will take into account these kind of benchmarks, such as the 75-20, and where we're at with that, and then move on to assess the next phase based on these kind of parameters.
It's Dr. New. Maybe I just add to what Dr. Tam has said. As we've always said, it's not just the issue of, quote, vaccine coverage alone that'll determine, at a local level, what the public health measures can maybe be slowly let go. We've always said that we have to look at the epidemiological situation. So certainly the Delta variant comes into that, looking at sort of the community transmission aspect, looking at the healthcare system, the indicators in terms of hospitalizations, how many people in the intensive care unit is the healthcare system being overloaded in certain parts of the country? Those are all the other factors that need to be closely looked at. And that's why we keep saying that you can't let go of the public health measures, both at an individual level as well as at a sort of a population level, as the vaccine rollout continues to unfold throughout the country. Thank you.
Okay, we'll take the next question, please.
Thank you. The next question. La prochaine question est de Mélanie Marquis de La Presse. Please go ahead. La parole est à vous.
Merci.
Question.
Hajdu. So a couple of things. The quarantine hotel disappearing, that's only for Canadian citizens, permanent residents, or essential workers. So nothing for tourists yet. And what about the types of vaccines that you require? So somebody who was vaccinated with the Sputnik vaccine or another vaccine that's not approved in Canada, is that person considered completely vaccinated?
Minister Hajdu, you may be muted if you're speaking.
Thank you very much, Melanie, for the question. And perhaps I can start in English and Minister LeBlanc can add a few words in French as well. Yes, you're absolutely right. The requirement to stay in a government-authorized hotel is being lifted for people who currently have the right of entry to Canada. We're not changing anything yet on the right of entry to Canada, and the categories that are approved for entry right now will remain the same. The difference is that fully vaccinated travelers with a right of entry to Canada will be able to forego staying in a government-approved or government-authorized hotel until such time that they receive their negative day one test. And that's the big change. And you're also right on part two of your question, which is which vaccines will be accepted. And they are only the vaccines that are approved in Canada. by Health Canada. And so this would be AstraZeneca, Johnson & Johnson, Pfizer, and Moderna. And of course, we'll be assessing other vaccines as we move forward into other phases.
Suivi? Sorry. Go ahead.
Mélanie, peut-être je peux juste...
Melanie, maybe I can... I didn't want to cut you off, but we'll take your second follow-up question afterwards. But I would just like to reiterate what Patty Haidu just said. So the changes that we are announcing today will be effective for those who already have a right of entry into Canada. So that's, Canadians coming home, permanent residents, and essential workers, foreign students, or new immigrants. But those who are fully vaccinated. So that means specifically vaccinated with vaccines that have been approved by Health Canada. There are 4 vaccines that have been approved by Health Canada. And so those people who are fully vaccinated do not have to stay in a government-authorized hotel to wait for the results of the tests that they must take when they arrive in Canada. The screening tests are still in effect. However, fully vaccinated people can quarantine at home while awaiting the negative result of their test on arrival. And there will be lighter quarantine then. Go ahead for a follow-up.
I guess my follow-up would be for Minister Haidu as well. You've heard people from the business sector, the tourism sector, who want the Canada-US border to reopen as soon as June 22nd. And what they actually want is a plan as well. So how far along are you in elaborating on that plan?
You're muted, Minister.
Thank you again for the question, and I'll answer in 2 parts, Melanie. One, I fully understand the need for certainty for business and for planning. And without a doubt, the tourism sector has suffered tremendous loss as a result of the restriction in movement around the world, including here in Canada. But we also know that the economy has had a terrible shock for communities as people have had to live through various public health measures to protect the health of Canadians that have placed a serious price on people's functioning in not just the economy, but in schools and in many other social settings. And so what we are saying is that it is better now to be slow and cautious, to use the best science and evidence, to be careful in our approach so that we can have a sustained success rather than rapidly moving and seeing outbreaks or cases surging in a way that would result in further restrictions having to be applied. We are on a very good path, as Dr. Tam says. It is looking very hopeful across the country. And vaccination rates are rising tremendously. And I thank Canadians and the immunizers who are doing a phenomenal job getting people immunized. But we do want to be careful and cautious on these next steps to make sure that we are not putting that recovery in jeopardy. And in terms of the planning, that planning is underway. We have a variety of phases that we're working on, and it will be based on, as Dr. Tam and Dr. New have pointed out, our own epidemiology, what the virus is doing within Canada, as well as what we see is happening with the virus externally. Many countries are struggling with this right now. And of course, some countries have taken very strong stances to open and had to reclose or adjust, who can travel and when. And what we want to do is take things carefully and cautiously so that we can sustain this recovery for Canadians.
OK, prochaine question, s'il vous plaît.
The next question, la prochaine question, is from Tonda McCharles from Toronto Star. Please go ahead. Your line is open.
Hi there. Thanks for taking my question. I think, Minister Haidu, this is also for you. So, I'm sorry.
Tonda, we're just having a hard time hearing you. Sorry about that.
Can you hear me now?
Yep.
Yes.
Can you hear me now?
We can hear
Yes.
you.
Awesome, thanks. Minister Hajdu, I just want to be very clear on your timetable here. It's not clear to me because you said what is currently being considered as the first step of this approach, and then what the metrics that you're looking at are being considered as you move towards changes that you hope to have in place in early July. So do you have an actual start time when this very first step is to take effect?
Oh, well, thank you, Tanda. And we are still having conversations with provinces and territories as well to ensure that they're comfortable with this step. But we're aiming for early July. And I know that you would prefer a precise date, but we are working with CBSA, IRCC, and a number of other departments to make sure that we're operationally ready for this change. And so as soon as we have a confirmed date, we'll come back. But the general ballpark is the first week in July.
And so that's for the fully vaccinated Canadian citizens and permanent residents. Do you have a ballpark for when tourists and business people may be able to move more freely without having to do the hotel quarantine and or the other quarantine levels? Is that late July? Is that early August? Is that...
Well, actually, the metrics we're looking at are less date-oriented and more disease activity-oriented. And I'll turn to Dr. Tam in a moment, but it is really about making sure, again, that we can see that trajectory of less people getting sick, less hospitalizations, more capacity of provinces and territories to handle any outbreaks, and a confidence that the vaccination coverage here in Canada is going well. And as well, very closely monitoring how the virus is changing and shifting and adapting in other countries. We know that there are, on an ongoing basis, new variants that are developing that we know about and ones that we don't. And my goal as health minister is to make sure that we don't put any of this progress that we've made together, that has been hard won, by the way, on the sacrifices of Canadians and Canadian businesses and entire sectors. We don't want to jeopardize that in any way. So I'll turn to Dr. Tam to perhaps she can talk a little bit more about the deliberations that she's having with her colleagues.
I don't have much more to add, but I think with the trajectory, at least on the vaccine target, we're on track for that 75-20 goalpost for eligible Canadians. The next goalpost on that front that we'll be assessing is around when we achieve the 75% two-dose for the eligible population for vaccination. So that is going to be taken into account, and you can probably look at when we might get there based on your the vaccine supply, but of course it's also based on how many people actually roll up the sleeves and to get not just the first dose, but the second, and then all the other parameters that the minister has outlined as well. So, the first marker might be around the first week of July, and the next one may or may not come quite soon, depending on whether we meet some of those markers.
Okay, we'll take the next question.
Thank you. Merci. The next question. La prochaine question est de Raymond Sillon de TVA. Please go ahead. La parole est à vous.
Merci beaucoup. Bonjour à tous.
Thank you very much. I have a question for Mr. Leblanc with regard to the relaxation of measures you mentioned today. What proof will you ask for from travelers to ensure that they are fully vaccinated and therefore don't have to go to a hotel? Is there a vaccine passport or some kind of document for everyone that you can use? As I believe we have already been saying for a number of weeks, and you are absolutely right, the federal government, in partnership with the provinces, is developing a kind of vaccine passport for Canadians who will be traveling abroad and then coming home. We have been undertaking significant discussions with the European Union and with the United States, but Prime Minister Trudeau and the premiers of the provinces and territories have agreed on the importance of having a national document proving vaccination while respecting that medical record information belongs to the provinces and territories. But the specific phase beginning in July for Canadian citizens and others, well, in the coming days, we will be working with the CBSA, with the IRCC as well, who are responsible for passports. Well, we'll be working out that kind of technical detail. And we will be ready, if it does happen at the beginning of July as we wish, when the time comes, the border agents will have everything they need to ensure that there are temporary measures up until the national vaccination evidence or vaccine passport is ready. But all of those technical details will not prevent the measures from being applied, and everything, as we have said, will be based on scientific evidence. But in the next few days, we will be providing more details, either Minister Blair or Minister Mendicino, with regard to the technical aspects of vaccine proof. Follow up? So if I understand correctly, the vaccine passport could not be ready before the phase that comes at the beginning of July. Have I understood that correctly? Answer, that's right. Possibly the national vaccine passport that we will be undertaking in partnership with the provinces, it may not be ready 2 to 3 weeks from now at the beginning of July. However, we recognize that it's important to build the capacity of our CBSA agents so that they can decide whether a Canadian who's coming in from the United States or is coming back from a trip and is fully vaccinated to be able to determine whether they're fully vaccinated. And there will be flexibility at the time the measures we're announcing today are applied. We want to have flexibility for Canadians to show that they're fully vaccinated, but at the same time, we are working on a much longer term and permanent solution in the coming weeks as well.
The next question, la prochaine question est de Ryan Tumulty from the National Post. Please go ahead. Your line is open.
Yeah, hi. This question is probably for Minister Anand. I'm wondering, with Moderna's commitment to deliver 7 million doses in June, is that enough doses to have them reach their 12.3 million target for the second quarter?
Well, thanks so much, Ryan. I really appreciate the question. You'll recall that we had targeted to receive 10.3 million doses from Moderna as they revised that target earlier on this spring. And so, in fact, they're going to be exceeding the 10.3 million target. They'll be delivering in cumulative numbers 13.2 million if you take into account Q1 and Q2. And if you take into account Q2 alone, it's 11.2 million doses from Moderna. So in short, I want to say that we are very pleased that Moderna was able to commit to 7 million doses to arrive in the month of June. Of course, we are still pressing all suppliers to deliver more vaccines earlier. That's why we've been able to accelerate 28 million doses from later to earlier quarters this year. And we will continue to work all angles, not just with the suppliers, but also with the U.S. government in terms of additional supply potentially from them. So the bottom line is that our numbers for Q2, if that's what you're focused on, are not final yet because we're continually involved with negotiations on the supplier side and other sides. But I want to be clear that our vaccination rate has continually increased because of the supply of vaccines that has rapidly increased in the last weeks and months. We are focused on the delivery of vaccines from all suppliers coming into Canada. And in terms of confirmed deliveries moving to the end of July, 80% of eligible Canadians would be able to be vaccinated with the supply that we are bringing in. And that's confirmed deliveries. So I hope I've answered your question. If not, please ask me another one. Thank you.
Go ahead with your follow-up, Ryan.
Yeah, so I guess the 11.2 million, while great, is slightly short of what they promised. Originally, I know they revised that target. I'm wondering if there's any sort of penalty in the contract with Moderna for that. And I'm also wondering, with 7 million doses coming in such a concentrated fashion, is there any concern about, while it's a good problem to have, about provinces being able to handle that big influx of doses all at once?
Well, I'll start, and then I'll ask Minister Hajdu potentially to speak, given that she interfaces with the provinces and territories more than I do. In terms of the contract with Moderna, their numbers were targets primarily, so they are not in breach of contract. And indeed, we should be grateful that they are prioritizing Canada for vaccine supply in light of the incredible global demand for vaccines that we are seeing across the board. The fact that they are allocating 7 million vaccines to Canada is indeed as a result of our continuing to press the supplier again and again for firm delivery schedules and firm numbers. And so that 7 million, Ryan, is a very good number for Canada, especially in light of global demand. And we'll keep working with the supplier to accelerate other vaccine deliveries into earlier quarters, as I've already mentioned. In terms of the shipments of the 7 million vaccines, these are going to come in 2 or 3 shipments. As I said, they'll be coming from the United States, and so those shipments cannot begin until Health Canada approval has been obtained for the new source of the supply. Once those vaccines come into the country, they will be rapidly and expeditiously deployed to the provinces and territories, of course, and we'll make sure that as little time as possible is spent on that process with our supplier, FedEx, that is providing very, very strong service across the country for us at the current time. Patty, do you have anything to add on the provinces and territories utilizing vaccines?
Oh, I'll add a bit and turn to Dr. Tam. Actually, the provinces and territories have been working very effectively with the Vaccine Operations Center out of the Public Health Agency of Canada, and have a number of mechanisms in place to adjust for any delivery disruptions as well as delivery acceleration. So maybe Dr. Tam, I know you intersect with the Vaccination Operations Center more often than I do, and perhaps can say a little bit about the work.
I think Brigadier General Brody may have more of that detail. We can get back to you. But based on what I know about the daily capacity of the provinces and territories to deliver, they are able to absorb that that confirmed delivery from Moderna, and they're not at their capacity as yet to deliver more doses. So again, I hope is Canadians being as enthusiastic as they have been to continue to access the provincial territorial programs.
Okay, that will be the end of the press conference. Oh,
sorry.
Sorry, go ahead.
Sorry, I was just going to add there, Ryan, that Canada has delivered 30.6 million doses to the provinces. The provinces have administered 26.5 million doses thus far. Thus, there is a spread between what we are delivering to the provinces and what they're utilizing. At the same time, however, we are hearing from the provinces and territories that they do want more and more vaccines. They would like to open more clinics. They would like to stock their clinics with more vaccine. And so we are essentially continuing to provide vaccines to the province in light of very high demand for vaccines, not just from the provinces and territories, but from Canadians at large. Thank you.
Okay, merci. Ça met la fin de la conférence de presse aujourd'hui. Thanks, everyone. Good afternoon.